How does the Tennessee Department of Health promote public-private collaborations?
We know we have about 3,500 folks that consider themselves Tennessee Department of Health employees, and we have a budget of about $580 million. We are trying to move population health needles for 6.6 million people. Well, if you do the math, that's a lot of people for one of those 3,500 folks to move. So there's no way we make substantial population health movement without a lot of partnering and engaging. In fact, that's a part of our vision. We want to be a recognized and trusted leader, partnering and engaging to accelerate Tennessee into one of the nation's healthiest states. My favorite kinds of engagement, though, are with small businesses through the Primary Prevention Initiative. I think larger corporations kind of get primary prevention because they understand what it costs them in terms of their revenue and the costs of products that they sell to their customers when their healthcare costs are high. I think what we haven't done a good enough job in overall is really emphasizing how important not just traditional clinical prevention programs are, because that's what I sell when I'm wearing my physician hat, right? Let me show you what I can do, to help your employees, get and stay healthier. And clinicians do some really valuable primary prevention things, including giving advice, including providing vaccines. But we typically don't, get companies to move in the direction of better workplace safety, of encouraging employees to be active, and what ways you do that intentionally. You can't just say, hey, you should go home and be active. You have to really be intentional about that. We try and do that here, by the way, through something we call walking the talk. We're being more intentional about the way we do that with our own employees, both in the Department of Health and I think we've been moving the needle on that across state government. But I think the core of this is the public health enterprise has not been as successful as it needs to be in gaining partnerships with the private sector writ large. And until we do that, and until the private sector, I think, sees how important primary prevention is, how important it is to think deliberately about how we move upstream from some of these chronic health issues that vex us, we're not really going to get ahead of this crisis.